Hi everyone. If you're watching this, it probably means you've just had your rhinoplasty procedure done with me. So first of all, well done, and I hope you're feeling okay. In this video, I'm going to walk you through what to expect after the next few days and how to look after yourself at home and when we'll see you again. The dressings should look something similar to this. Underneath the dressing, you'll have a moustache dressing, and keep this on for the next 24 to 48 hours. You will have some ooze coming through your nose, and this dressing should catch this. If it does get a little bit stained or wet, we've given you some spare dressing so you can change this gently. The most important thing is, if you do notice any ooze, don't sniff out and don't sniff in. Allow the dressing to catch this. After about 24-48 hours, you can take this dressing off, but if you do have any ooze, just gently pat your nostrils dry. Again, don't sniff out and don't sniff in. We've given you some ointment as well, so you can apply that to the tip of your nose after the first 24 to 48 hours. You will also notice that you won't be able to breathe fully through your nose, so you'll be doing some mouth breathing, and that's going to be a little bit uncomfortable for you. Overnight, try and sleep upright. I know it's going to be difficult, but sleep on a couple of extra pillows. If you do fall off, that's fine, but it's really important to try and sleep upright, and you will be mouth breathing, so you may wake up every few hours because it is very uncomfortable. After the first few days, you will notice that you'll be able to breathe through your nose a little bit more freely, but it will still be a little bit difficult, and that's something that is fairly normal after the surgical procedure. I've also given you some painkillers. Take these painkillers regularly for the first few days. The other thing is that you need to make sure you don't do any heavy lifting or bending over in the first few days. And when you do brush your teeth in the morning, make sure you brush it gently. When it comes to eating and drinking, try and have a soft diet in the first few days. And afterwards, when you become a little bit more comfortable with things, try go back to a normal diet. Over the first week, you will notice that the dressing becomes loose. This is completely normal. Pat the dressing back on, and we've also given you some spare tape if the forehead dressing does become very loose. Hopefully you will have been given an appointment to see me in about a week's time, and I will take your dressing down, and hopefully we will give you a reveal. But it's important that you will be very swollen in the first few weeks particularly. You will have some bruising over the next couple of days, particularly around the eyes. I hope your recovery is comfortable. If you have any problems, do let us know. Take care of yourself. Bye.